Hi everyone, this is the last of our mini lectures for Chapter 11. I should be finishing up the chapter today. I first want to talk about what happens in your body with an infection or disease. And so with an infection, there are different stages to the infection. The first of which is considered the incubation period. And this is the time from when you have initial contact with the infectious agent. So that's the start. The end of the incubation period would be the appearance of any symptoms. So the agent will be coming in through its portal of entry, which could be a number of different places, and it will be multiplying at that portal of entry, but it will not have caused enough damage yet to show symptoms in your body. And this will vary according to host resistance, also how virulent the microbe is, and the distance between the target organ, for example, if it's something that targets the lungs, and the portal of entry is through the mouth or nose, that distance may affect how long it takes for that incubation period to last before you start showing symptoms. And the range on this can be several hours to several years depending on the microbe, although the majority of infections, the range is from 2 to 30 days. So after we have our incubation stage, the next one would be considered the prodromal stage. And this is generally a 1 to 2 day period when you have your earliest symptoms of the infection. It tends to be vague feeling of discomfort. It may not be completely all of the different signs of that particular invasion or infection. The next stage is what is called the period of invasion. This is when that infectious agent is multiplying at its highest levels. It's also when it causes the most damage, and it's often marked by fever and other symptoms that would be very prevalent. And this is an extremely variable length of period depending on the microbe or infectious agent. The last then period of what happens in your body with an infection is considered the convalescent period. This is when you start to recover. The patient generally responds to the infection and the symptoms decrease. And the patient's strength and health gradually return. And this is that immune response of your body taking over and bringing you back to health. This is a period when often patients will stop taking antibiotics because they feel better. But this is why you must continue, because you will still have the pathogens in your body and you need to make sure that you kill them all off before you stop an antibiotic regimen. So that's what happens in your body. Let's talk a little bit about the idea of how we acquire and how infectious agents are transmitted. There's some vocabulary I'd like you to know, the first of which is called communicable, and this is really synonymous with infectious. It's meaning that the disease which infects one host can be transmitted to another host and establish an infection in that second host. And this just means that the disease is transmitted from host to host. Contagious is a little bit different. Contagious refers to how easily or how highly infectious or communicable something is. For example, influenza and measles are highly contagious. They're communicable, but on top of that, they're contagious. This would differ from the Ebola virus, which is a communicable or infectious disease, but it's not very contagious. It's actually more difficult to get than influenza and measles. So non-communicable, this would be an infectious disease that does not arise through the transmission of an infectious agent from host to host. So what does that mean? How do you get something that's non-communicable? There's a number of different ways. The first would be in somebody who has a compromised immune system and perhaps something from their microbiota in their body infects them. Or perhaps they have accidental contact with a microbe that exists in a non-living reservoir, and that could be something like the soil or water. And the last way would be an infected person does not become a source of the disease to others. So even though they're infected, they cannot give it to somebody else. That would make it non-communicable. For example, something here might be a sinus infection because it's a bacterial infection of your sinuses. That's not actually communicable to another person. So how are the patterns of transmission looked about in communicable diseases? We can have direct or indirect contact with animate or inanimate objects. So you can kind of think about different ways that this might happen, knowing different types of diseases that you might already know. We have what is called a horizontal transfer, and this is the typical way that things are transferred. The disease is spread through a population from one person who's infected to another. You could have vertical transfer, where the disease is transmitted from a parent to offspring. So there may be something, a mother who is infected who actually transmits something through breast milk, something like that. And there's two major modes of transmission. We have direct contact or indirect transmission in which some vehicle is involved. And that could even be something like a needle or perhaps an insect to transmit something that's indirect. And then one of the ones that's most important when we look at the healthcare field are what are called nosocomial infections. And this is where the hospital is where the source of the disease occurred. So these are infections that are acquired or developed during a hospital stay. This is a huge issue now with healthcare. There's a number of different reasons for that. The fact that we have a lot of people in the hospital who are ill. We have healthcare workers moving from one patient to another and perhaps transmitting things. And then instruments that are used. If there's not proper care taken of these instruments, they can cause these type of infections. So on average, 5% of all admitted patients will acquire an infection while staying at the hospital. There are 2 to 4 million cases a year, which results in 90,000 deaths. And this is a huge expense in the sense that it's 8 million additional days of hospitalization and an increased cost of $5 to $10 billion a year. So this is one that hospitals are really trying to cut down on. So that was kind of talking about infection, what it does to our body, and then about communicable diseases. But when we look at a broader picture, we want to talk a little bit about epidemiology, which is actually the study of disease in populations. And I did some research in this after graduate school with the AIDS epidemic and looking at the epidemiology or the frequency and distribution of the disease. So that's exactly what epidemiology is. It's the study of the frequency and distribution of a disease and other health-related factors in defined populations. So it involves many scientific disciplines that you have to either know or you might have to use within your study. And it considers all forms of disease, so not just infectious. It can include heart disease, cancer, drug addiction, mental illness. These are all things that would be included in the study of disease in populations or epidemiology. So to understand epidemiology, it's good to know with the statistics and learning about the frequency of cases, some vocabulary. I'd like to start with a little bit of the vocabulary, first of all with prevalence. And prevalence is the total number of existing cases with respect to the entire population. So that would be taking a look at, say, Boise. We take a total number of the existing cases of a particular disease, and we look at that next to the entire population. We can say what the prevalence is. So it's a percentage of the population that have that particular disease at a given time. We also have something called incidence, which measures the number of new cases over a certain time period. So prevalence is talking about existing cases, incidence is new cases. And this also can be called the case or morbidity rate. So it indicates both the rate and the risk of infection. So as we look at new cases over a certain time period, we know how quickly this infection is spreading. Both incidence and prevalence are followed over a seasonal, yearly, and long-term basis depending on the study. So when we look at these statistics, the big ones that are of concern to the epidemiologists are the rates of the disease with regard to sex, whether male or female, race or geographical region. This gives us a better grasp on what we're dealing with a particular disease. And then the mortality rate, which measures the total number of deaths in a population due to that certain disease. And what we see is the overall death rate from infectious diseases has dropped, but the number of persons afflicted with infectious rates has remained high. And mainly that's just a treatment. We're able to keep people alive longer even though they may be infected. HIV or AIDS is a good example of what used to be kind of a death sentence is now much more of a chronic disease. So a few more things that you should know. Index case, this is a vocabulary word meaning the first patient found in an epidemiological investigation. And it may not be the first case of the disease, but is the first one that brought the epidemic to the attention of officials. And then when we talk about epidemics or different types of infections in a population, the key vocabulary here is, first of all, endemic, and this is an infectious disease that exhibits a relatively steady frequency over a long period of time in a particular geographic locale. So it may be something that's endemic, it's at a low level, but it's continuously at that steady frequency. They haven't got it either cured or it hasn't jumped up and had a big spread. Sporadic would talk about occasional cases that are reported at irregular intervals and at random locales, so not a specific geographical location. And then when does something become epidemic? This is when statistics indicate that the prevalence or the percentage of infected within a population is increasing beyond what is expected for a population. And that is when we talk about it becoming epidemic. Epidemic then the next level up would be considered pandemic. And this would be the spread of an epidemic. So this increase beyond what is expected for a population across continents, so spreading from North America to Europe or North America to Latin America, that's when we get into the term pandemic. So hopefully this gave you a nice overview of transmission, infection, and epidemiology. That's the end of chapter 11.